The measles cases in the U.S., including here in Minnesota, has health officials concerned. The CDC reports nationwide there have been 211 measles cases thus far this year. The Minnesota Department of Health reporting as of today, 22 of those are here in Minnesota, most cases occurring in those who are unvaccinated. Joining us now from M Health Fairview, Roselawn Clinic in St. Paul, is family medicine physician Dr. James Latz. Dr. Latz, thank you so much for joining us.
You're welcome. Nice to see you.
So at this location, there's going to be a vaccine clinic starting in less than an hour or so. The clinic, we want to be clear to our viewers, it is not open to the public. This was targeted outreach. Tell us who was invited to take part in this vaccine clinic today.
Yeah, so our community partners in our East Side Health and Wellbeing Collaborative had told us that families aren't always having an easy time navigating to vaccine services, especially in the back-to-school time frame. So our community partners kind of helped us recruit some of those families that were having those barriers, and we're having this clinic and doing some other things across our health system to help make it easier for kids to get in for their back-to-school shots.
And we know there's various shots, but given these measles numbers, what do people need to know about that disease specifically? Are there signs before the rash starts? What should we know?
Yeah, I mean, I think the most important thing for people to know is that measles is a very serious disease for children 5 and under. It can be quite deadly, and it's completely preventable with vaccines. And so, yeah, it starts usually with a rash and a fever and a cough, but then in some people, especially in younger children, it can progress to really serious things like brain swelling.
And some of those, I mean, obviously it can have an array of problems afterwards, but how is it treated after the fact, after the diagnosis?
Yeah, with supportive care, basically. So there aren't, we don't have good antibiotics that fight the measles virus. So it's all about prevention. Around the world, literally tens of thousands of children die every year from measles, and we're lucky here, in Minnesota in the United States to have good access to vaccine so that we can prevent, kids here from meeting that fate.
And of course, we know for physicians like yourself, it's not just the measles that people are worried about. Bigger picture, kids going back to school. There was a new Gallup poll out just yesterday showing only 40% of people believe that it is extremely important for parents to have their children vaccinated. And that's actually down from 58% in 2019, 64% in 2001. What are you saying to patients not willing, not taking the time, for whatever the reason, not getting their children vaccinated?
Yeah, I'm just asking them to listen to their doctor that cares about their kid and has the right information. There's a lot of bad information out there. There's a lot of kind of a growing misconception that vaccines are somehow more dangerous than the diseases they prevent, and nothing could be further from the truth. I mean, take meningitis, for example. If your child gets meningitis, bacterial meningitis, they have about a 1 out of 10 chance of dying from that disease. And, a vaccine, the rate of a serious or life-threatening reaction after a vaccine is literally, 1 out of several 100,000. In all my years, in my 20-plus years as a physician, I've never had a child have a serious or life-threatening reaction to a vaccine.
What about, of course, for so many years now, we've talked about COVID and the COVID vaccine and COVID boosters. Are you seeing patients keep up on their COVID boosters and those shots, or are you kind of seeing that fall by the wayside?
A little bit of falling rates. I mean, I think across the state, we're seeing a slow decrease in the immunization rate across all diseases, but we're especially concerned about those back-to-school vaccines, the ones that are required for school, because they prevent diseases that are so devastating to children like measles, like meningitis, and the ones that can spread in an outbreak type scenario if not enough people are vaccinated.
All right, Dr. James Latz from M Health Fairview, we appreciate your time. We know you need to get going into the clinic there to see your patients, so we appreciate your time this morning.
All right, thanks for having me.
Thank you.